In this video, we're going to discuss a herniated disc in the lumbar spine. What is it and how can you treat it at home? So what happens with a herniated disc is the nucleus inside the disc is surrounded, the outer portions of the disc is a really strong fibrous band or collection of fibrous bands. So what's going to happen is that nucleus inside is going to push out through those fibrous bands to a weakened area. That's going to come out and apply pressure or kind of come down the nerve roots that go out to different parts of our body, and that's going to cause some pain. It also can go down to the spinal cord, the spinal column, and compress that, put pressure in that area. And so what we want to do is try to reduce as much pain as we can, restore range of motion, and improve our strength. Our first technique is going to be spinal decompression, and there are several ways that we can decompress the spine at home. Number one is just going to be sitting. So you're going to go sit in a chair, put your hands down beside you like this, push down the bottom of the chair. So what I'm doing is I'm pushing down. I'm not going to push down so hard that I pick myself up off of the chair, the surface I'm sitting on. I'm just going to push down a little bit. I feel that stretch in my low back, and then I'm going to relax. I'm going to push down again, hold that maybe 5 to 10 seconds and relax. If your chair has armrests on it, that works really well because it's a little easier to push yourself up. Now, if you don't have a chair with armrests or that's uncomfortable because of your arms in that position, I'm going to show you another technique that you can do. So you're going to take one of these exercise balls. If you don't have one of these, you can use several pillows. I've had patients stack pillows up and do the same thing. And what you're going to do is just kind of lean over the ball. So I'm leaning over the ball and I'm creating that stretch in my low back. So I'm going to turn it so you can see that, just leaning over the ball, creating that stretch in the low back. You're going to do that the same way. You're going to hold that maybe even a little longer with this. So maybe we hold it 20 seconds, 30 seconds. You can go a little longer because there's less force. Basically, I'm just lying over the ball, not really having to do anything with my arms, so just going to hold that. That's a great way, again, to kind of stretch those lumbar structures, those structures in the low back, and really just kind of open everything up. And that's something you can repeat several times a day. Our next movement is going to be standing trunk extension. So what you're going to do is put your hands on your sides, put your feet wherever it feels nice, comfortable, and stable, and you're going to work on leaning back. And the real focus here is just initially go back as far as you can, tolerate with your pain, and you're working towards going back farther and farther to where eventually you can go back really far. You're going to repeat that for 10 to 20 repetitions for a couple of sets, and that exercise is something you can do throughout the day. So from the time you get up to the time you go to bed, just throughout the day, you can work on going to that extension movement. Next, we're going to perform prone cobras. So with this, you're going to lie on the floor, on the bed, and you're just going to work on propping up on your forearms like this and kind of extending up, and you're creating a little bit of sway in the low back area, and you're going to kind of come back down and then kind of go back up on your forearms, creating that increased sway or pressure there. Hold that and then come back down. I typically have patients hold that for maybe 3 to 5 seconds. Just depends on how you feel. Again, if that's too painful, you can avoid this one until you feel a little bit better. Work on that standing extension movement first, but then you're going to advance to this one, and then you want to go all the way into a prone press up or the prone cobra like this, coming all the way down, really working on creating that increased extension in the low back area. But again, if that exacerbates your symptoms, makes them worse, and it may initially flare things up a little bit, but if it gets too painful, then back off of those and go back with those simpler movements that we started at the first. Our next exercise is going to be a seated cat-cow. Now you can do this on your hands and knees, that's fine, but for a lot of patients, especially with a lot of low back pain, it's difficult to get in that position. So I like to do it seated in a chair. So what you're going to do is you're going to sit in a chair and you're going to round your shoulders forwards and kind of hunch over. And as you hunch over, you're kind of tucking your pelvis in, rounding all the way around. You're going to hold that about 1 to 2 seconds, and you're going to come back. This is going to be the cow movement. I'm really poking my chest. I'm increasing that curve in my lumbar spine. And then I'm going to come back, go back into the cat movement, really round over, and then come back into the cow movement, extending the trunk, going back. You're going to repeat that for 2 to 3 sets of around 10 to 20 repetitions. Now I want to perform some strengthening exercises for the back. So what I'm going to use is a kettlebell. You can use dumbbells, kettlebell, just whatever you have. I'm going to put this on the mat. Now initially put it in a chair or a surface that's not too low, so you don't have to go very far. What I'm going to do with this is bend my knees just a little bit, so my knees are slightly bent. My feet are just what feels comfortable as far as spacing, and then I'm going to bring it back, stand all the way up, lean back a little bit, come right back down, and let that sit back down on the chair or whatever surface you're using. Come back again, and I'm keeping this close to my body, so this is not way out in front. I'm keeping this close to my body so that when I go back, just kind of let my arms hang and just kind of hook the weight not really doing much there. And repeat that for 2 to 3 sets of around 10 to 12 repetitions. Really focus on the control with that. And then you eventually can go to where you're not using that surface. It's almost basically like an RDL. So you're going to bend the knees a little bit, keep the weight close to you, keep the back nice and flat, and just kind of come back like this, almost like a partial deadlift. And for me, with my patients, I really work on at the end, extending the back, just that little bit of extra extension, and then come back down. And you're going to repeat that for 2 to 3 sets of around 10 to 12 repetitions. For my last strengthening exercise, I'm going to take that same kettlebell, I'm going to hold it on one side. What I'm going to work on is just leaning away from the side that I'm holding the kettlebell on, and then back to midline, lean away, back to midline, then I'm going to swap to the other side. So whatever side you're holding the kettlebell on, lean away from it. And again, this can be a dumbbell, it doesn't have to be a kettlebell. And if you don't have dumbbells or kettlebells, maybe all that you have are those exercise bands, you can do the same thing. Basically just stand on the exercise band and hold it in your hand and lean away. That'll just create that tension. Repeat that for 2 to 3 sets of 10 to 12 repetitions to each side. Lastly, we're going to follow it with a stretch. So what you're going to do with this is just do a knee to chest stretch. You're going to pull the knee up like this. You're going to hold it for around 20 seconds. You're going to feel that stretch in the glute and the hamstring area. You're going to hold that. Then we're going to swap over to the other side, hold it the same way, somewhere around 20 seconds or 30 seconds, and relax. And that's something you can perform just throughout the day. Thank you so much for watching. I hope this video helps with your lumbar disc herniation. Be sure to hit that subscribe button so you can stay up to date on all my content. Thanks so much.